I'm Hussain. I'm a consultant interventional cardiologist. I work at the Royal Berkshire Hospital. Today I'll be talking about a very common complaint patients of mine have, which is palpitations, feeling lightheaded, and also losing consciousness. The way we manage this is to first see patients face to face, take a very accurate history and examination. This is then followed up by a 12-lead ECG, where we implant electrodes onto the skin and measure the heartbeat for a few seconds. What we do next really depends on the frequency of symptoms. For example, if palpitations are occurring every single day, then performing a 24-hour heart monitor would be reasonable. During that time, I've asked patients to keep a clear diary of their symptoms and time, and we then correlate the monitor with the symptoms to determine is there anything on the heart monitor to explain why palpitations are occurring. If, however, the symptoms occur, for example, once a week, then of course we'll need to do an extended heart monitor, perhaps for 2 weeks, to ensure we capture the symptoms. Another test we commonly perform is an ultrasound of the heart. This looks at the pumping of the heart, the valves in the heart, and ensures there's no structural heart problem. The treatment we offer really does depend on the diagnosis. For example, if it identifies an arrhythmia such as atrial fibrillation or atrial flutter, then a certain management strategy will be started. However, if it identifies ectopic beats which are benign and relatively infrequent and not concerning, then perhaps no treatment is required at all. In other situations, patients often have no abnormality identified at all on their heart monitor, and instead we find that the issue is related to low blood pressure. When patients have low blood pressure, they can feel lightheaded, dizzy, and they can lose consciousness. Again, it depends on the entire story and the symptoms, but on occasion, this can be due to postural hypotension, which is essentially low blood pressure when standing, or low blood pressure when standing for prolonged periods of time. Routine practice to help patients feel better would be simple measures such as increased hydration, so ensure you drink maybe 3 litres of water a day, taking it slowly when standing up quickly. Compression stockings can be considered. Increasing salt in the diet can also be beneficial to help with blood pressure. And if all those measures don't improve symptoms enough, there are numerous medications which can be started, which can boost the blood pressure and hopefully in turn reduce the chance of feeling lightheaded, dizzy, and losing consciousness.